Gosh, all that talking and yes, yes, hand raised. I I realized I had you muted and I was sitting there talking and you didn't catch any of that, and I sincerely apologize. So I'm going to run back through that again. Give me 2 seconds. Okay, I sincerely apologize about that. So let's go through that again because there was a whole bunch that went there and there's a bunch of numbers that are coming up. What I did was I had a conversation. I was talking about the deductible planning. I'm going to go back into the presentation slide and just walk through that. I sincerely apologize. So here there's the deductible. So the summary of benefits actually runs down for you kind of what you can look forward to as far as having to pay for any kind of healthcare interaction. And that's what I call them. They should be interactions. They should not be one-sided. There should be a lot of participation on your side and accountability on the side of your providers. But the accountability and the participation comes when you're looking at, okay, what is my deductible? So for this individual, and shout out to healthcare.gov, when I was going through with a client to help them figure out their insurance, I was able to pull this off and use this as a template moving forward. So as you can see, we're going to kind of just focus on the single person. I know people have families and I understand that, but just for numbers reasons, we'll focus on that. So the provider, in-network provider, or they say participating provider, they're $5,500, right? And then for the family, it would be $11,000. Now, if you come down here, because there's a deductible, there are out-of-pocket costs that you have, there's co-insurance. So there's all of these things that you have to kind of take into account when you're looking at how you're going to use your insurance coverage, or when you're thinking about planning this out. So the out-of-pocket maximum or the out-of-pocket limit is usually more, sometimes, very rarely, sometimes, depending on what your employer has chosen or what you yourself have chosen, sometimes your deductible and your out-of-pocket max will be the same. I've rarely seen that. Most times there is a deductible amount, which is $5,500, and then your out-of-pocket limit, because they're accounting for expenditures that you would have in addition to your deductible, co-insurance, co-pays, and the like, would be higher. So as you can see here, it's $5,500 for the deductible. It's $7,900 for participating providers out-of-pocket max, which is about, give or take, $1,400. Now, if you, and I think this is the same one, yeah, so if you look at non-participating providers, right, when you're looking at the deductible difference for a single person, it's $15,000, but your out-of-pocket limit is going to be an additional $10,000. So you're looking at $25,000 coming out of your pocket every year. And I believe this takes into account premiums. No, it does not. I'm sorry, it doesn't take into account premiums. So that out-of-pocket amount is in addition to your monthly premium. And I think I spoke about, yes, last session I did talk about why insurance is, a lot of the question that I get or the statement I receive is, my insurance is ridiculously expensive. And if you watch the previous session, which would be session number 3, I do provide an explanation for that. But as you can see, there's a significant gap actually in what you can be expected to pay out of pocket if you're staying in network, as opposed to what you're expected to pay out of pocket if you're coming out of network. And a lot of times insurances are really trying to, I'm using air quotes, incentivize you to stay within the network, because those are the providers that they have contracts with. I also want to talk a little bit, see if we can use some of this planning piece to discuss the diagnostic testing, preventative care and screenings. Healthcare.gov has a list of what preventative care and screenings are considered, and those don't necessarily, on that document that I have, they don't incur a copay. They still will be charged because their service is being provided. But with the preventative services and screenings, sometimes that initial out-of-pocket cost that you have when you go to the provider isn't there. So with that being said, what I was doing here on this document, and this is kind of just the putting it all together, and these are examples of how you would plan and how you would look at numbers. And please don't allow your eyes to get crossed. I know it can be a bit overwhelming, but I wanted to talk about a couple things. So there's a deductible amount, which is the $5,500 that we saw in that document. There's the out-of-pocket max or out-of-pocket limit, which is $7,900 because we're looking at this as an example of an individual. And then I talk about expected versus unexpected costs. And I wanted to get into that just so quickly when it comes to, I'm planning out, I'm going to see my primary care physician. And I'm using myself as an example here because I have a primary care physician, I have a cardiologist, and then I have a GYN, right? So my cardiologist and my GYN are considered specialists. So they're going to always be higher, whether that's a copay or the services that they provide. And then my primary care physician, as you can see, the copay, and these are, these are just kind of numbers to show you so that they're there, what the copay would be versus what the annual service is going to cost. And then what I did up here was for the primary care physician, there was an annual for the services that are $250. I did a 70-30 split for coinsurance. That means that 70% of the bill is my responsibility and 30% of the bill the insurance will cover. Sometimes it's 80-20, sometimes it's 20-80. It can flip. That's why it's I was saying it's very important to take a look at your summary of benefits or your benefit brochure so that you know what part of that service is going to be your responsibility on top of the copay and the premium. So I did a 70-30 split, and based on that, out of the $250, and the copay does not count towards your deductible, unfortunately. That just is money blowing in the wind. It's like, oh yeah, I spent this $45 and I don't even get credit for it. But the $250 of that, based upon the 70-30 split, $175 of that will be my out-of-pocket cost, right? So that's what I'm going to have to pay. And then I went down and did that for the cardiologist, the same 70-30, and I got pretty much $300, right? Because $297.50, we're going to round that up. So $300 I'm responsible for out-of-pocket. And we'll do the same thing for the GYN visit, right? Which is $550. Multiply that by 70%. So that's $385. Right? So 385, and my totals are 175 plus 297.50 plus 385. So I've spent, and I'm again using air quotes, I'm paying out of pocket $900. So it's $800, $857.50. That $857.50 will go towards your deductible, right? Because that's money that you're spending out of your pocket. And then as you continue to plan, so let's say you decide that you want to see, let's say you want to go see a therapist. So you see a therapist, you have a work-life benefit. So after that work-life benefit, maybe they give you 2 visits. You're on your 3rd visit and you have a $45 copay, right? So that's your copay. And then the service itself, they charge, so we're going to say visit. So the visit itself is, I'll say $125, right? Now for therapists, I I think they bill a little differently than the actual providers. Sometimes your copay can go towards your visit amount. Um, Again, it's really important for you to look at that summary of benefits because that's going to determine whether or not you how that amount is applied. So 125 you're responsible for on top of the 45. Let's just go, we're going to stick to the thing. So you're going to add another 125 onto that, and that'll give you a little over 1,000, I think. No, I'm sorry, a little less than 1,000. Yeah, you're at 982. So it's kind of difficult, right? Unless you're somebody who has chronic illnesses and constantly going to, your physicians. It's kind of difficult to meet that $5,500 deductible. And then I did mention while I was muted that this is also, though, very helpful in your ability to plan and have conversations with your providers. So, for instance, I said, you're going to your cardiologist. They want to see you quarterly. So you're going every 3 months. Every 3 months is costing you $300 to see that cardiologist. And a cardiologist, you spend maybe 5 to 10 minutes talking to, 10 minutes is kind of high, but on average, it's about 8 to 9 minutes talking to the cardiologist. And then the rest of it is maybe lab work. They checked your labs. Maybe they're checking your blood pressure and having a conversation with you about your lifestyle. And that makes up that 10 minutes. You end up spending probably about 30 to 45 minutes in the office as a whole. And then you're coming back and you're doing that again. And possibly they're re-ing up your medications if you're on medication. So this is a really good way if you're planning this out in any point in the year. It doesn't have to be at the beginning, but it's helpful to be at the beginning. If you're planning this out and you're saying, I'm spending $300 to see you every single time I'm coming, on top of, time travel and all that good stuff. Is there a way that maybe we could back this off? Because $300 a pop is a lot for me. Or, maybe $300 you're sailing and you're good to go. I'm not sure what your situation is, but this is a way for you to know and to be able to have a conversation with your providers. Hey, I'm seeing you. This is what it's costing me. That's a big, heavy responsibility, weight, or whatever. And, I just want to know, can we back this off? Can we maybe do it twice a year? Because you're telling me that I'm doing great. You're telling me I'm doing what I'm supposed to do. My numbers are good. If there's a problem, I'm willing to come in and be, I'm a compliant patient. I want to make sure that I'm where I want to be or need to be as far as my health is concerned. But I'm also aware of what my resources are, right? Because we sat and we went through the resources and gathered everything together. So these are great ways for you to say, you got your numbers. You can have these conversations, right? So that's where the planning, I think, is very helpful too, because it really shows you, all right, this is what my deductible is. Before my insurance is going to really kick in and help me out here, because I'm at a co-insurance of 70/30. So if this is what my deductible is, this is what my co-insurance is. These are the things that I know when I get that bill, I'm looking at $175. So maybe I'm chipping away at that bit by bit, or I'm having a conversation with the doctor's office about a payment plan or whatever the case may be. But you're definitely in a better position. You're empowered because based upon you're looking at your summary of benefits and going over that. And yes, it's gonna require some work. It's gonna require some time and some effort for you to do this, but you don't have to hold your breath and squint and do all kinds and put yourself in really funky positions, hoping and praying what that bill is going to be like when it comes in. So not gonna go all in, but so this is kind of the expected, right? So these are, hey, I know these are the people that I have to see at least at some point in the year. I know that I'm gonna be spending at least $1,000 out of my pocket. I'm not touching that deductible, but if other things come up, I have to do the ER or something like that, then maybe I'll get closer to that deductible. As I said, some people who have chronic diseases processes or they have new diagnoses and they have to get that diagnosis under control and change their lifestyle and see people as follow-ups. They're going to meet their deductible a lot sooner with a new diagnosis than if you have something that may be chronic or well maintained or well controlled. So let's do the unexpected, because I did the therapist. They can be expected as well. So we'll do unexpected. And unexpected includes, um, an ER visit or an urgent care visit, right? Because um, ERs, depending on emergency rooms, depending on the facility that they're affiliated with, they can be in network. But the doctor that saw you in the ER might not be, a qualified provider for whatever reason. Some urgent cares are not necessarily considered in network providers. So, those are unexpected medical expenses, and those are the ones that usually kind of knock people for six. And I'm very mindful of time. I know that I lost probably about 10 to 15 minutes, not talking, but talking. So I'll be mindful of your time, and I'll take a look and see if you have any questions. Um, no? Okay, cool. If you do, just let me know. If I'm going too fast, let me know that as well. So, urgent cares, ERs, urgent cares and ERs both have labs attached to them most of the time, and then sometimes they'll have radiological studies that you can get done for diagnostic purposes. So that would be X-rays are usually pretty much readily available at most urgent cares. They can do stat testing for flus and there's other stats, strep, so they could do stat testing for maybe strep throat. And I'm just trying to think of like some off the, if you some urinalysis type things. If you have like a urinary tract infection or there's something going on with your kidneys, they can do those on site. So those are like the off the top of my head kind of thing. So if you're going to the ER, let's say you have a initial visit and you have a copay of, we'll do $75, right? Well, I'll do a higher end copay because I see this sometimes with people who they go to the ER and their copay is $250, right? So you got a $250 copay. The service is billed at, let's say you went in and they did a blood work, urinalysis, and an X-ray, right? So your service was billed at $1150, right? And we're going to use that. We're going to use that 70/30 down here, right? So the co-insurance at 70/30. 70 you, 30 the insurance. Is looking like 1150.7. So you are at $805 when that bill comes in the mail, right? That is your unexpected. Now, great, that 800 pretty much is close to 1,000. So now you're at almost $2,000. So you're now at $3,500, and you're closer to getting rid of that deductible. But you have 800 and something dollars that you are now responsible for on top of that $250 copay that you just made. And then you still need to follow up with a primary or some sort of care provider who is going to follow your care, because ERs and urgent cares are only there for that one particular instance, and they don't usually do follow-up care. So you're still going to have to go back to your primary care physician, let's say, and say, this is the plan that they gave me, these are the meds, and let's check in and see how it's going. So you have a $45 copay, and maybe this time you go back to them and it's $125 as opposed to the $250, because they don't have to do a whole workup on you. A lot of the work was done with the ER. So that's just how you deal with like the unexpected costs. And I wanted to just go really quick, and we're kind of moving into that beyond the time thing, but I wanted to show you real quick on here. There we go. Diagnostic testing, right? So diagnostic, X-ray, and blood work. This is a service you need. If you have an X-ray, it's actually 50% of your co-insurance. And this is just an example. So if it's the $850, you would break that in half. So $425 they would pay, $425 you would pay. And no charge for freestanding facility. So sometimes your insurance will consider an urgent care as a freestanding facility, but it's really weird. You have to have a conversation with them. I always say if you're going into urgent care, if your insurance is open on a Saturday and it's a Saturday night, give them a call and ask them a question. If not, call them as soon as you can on Monday. And then, so this is the in-network, and then out of network, you're paying 50% of whatever that bill is, right? Generic drugs would be a $15 copay, and a good number of like antibiotics and stuff are now in generic form because they've been around for a bit. So you can, you'll pay a max of $15. Mail order is $30, and then out of network isn't covered. So you have to be really careful. You'll get a 30% reimbursement. So what that means is if your medication is $30, right? They'll reimburse you. You have to submit a reimbursement form, and they'll reimburse you that $9 off of that 30 that you spent out of your pocket. They said sometimes you have to have a prior authorization, so it depends. I mean, I consider sometimes new medications being prescribed as unexpected situations because you don't really know what you're going to have to deal with because you haven't had to deal with it before. So they will also fall underneath the unexpected. So that's, in a nutshell, that's the process that I would recommend you use to do your healthcare planning. Knowing that you now have all of these, because you have your dental and you have your vision brochures together, and you have your summary of benefits or benefit brochure that you can take a look at and run through, and then just really start tapping out. I'm a 30-year-old person who's relatively healthy. My deductible is $5,500. I'm only going to have to really see, if you're a female, I'm going to probably see at least a GYN, OBGYN. Hopefully you have a primary, but some people use their OBGYN as their primary. Or if you're a male, I have a primary. I'm only going to see that primary. And if something happens, then, I know what it's going to cost me, or I can now have the conversation and ask about certain things. So I hope that was really helpful. It's just really getting you started. An overview. I don't want to beat you over the head with too many numbers and too much information. So I'm going to hang out, see if there are any questions. And as of right now, no, I'll give it probably 5 or 10 minutes, for you to formulate anything that you may have questions about. And otherwise, it was great having you guys. This is the last session of this series. I will be doing another series probably in about a month or two, and I will notify you when that's coming up. I would like to send out a survey just to ask any thoughts, any ideas, what you think, feedback, what would you like to see in the next series, all that good stuff. So a few more minutes for hand raising. We're a little over time, and I do apologize. All right, well, I'm going to say I bid you adieu. It was great having you. In the email, when I follow up, I'll make sure that you have my contact information. So if there was something I covered here and it was a little confusing or I went too fast, and the session will allow for the email, will give you an opportunity to schedule a one-on-one session, and we can sit and go through the deductible planning just so that you'll have a template and can kind of move forward with that. All right, so thanks for your time on Sunday. I appreciate it. I look forward to seeing you in the next series, and enjoy and have a great rest of your week. All right, bye.